Morning, everyone. Happy spring. I have my spring tree that's in bloom across the street from our house. So I hope it's spring weather wherever you are calling in from. I'm glad so many of you could join us today for our second coffee chat session this year. I am Leanne Swanson. I'm the CEO of the National Center for Healthcare Leadership. And I want to welcome you all to our discussion today and thank our wonderful colleagues who are going to be sharing their insight into one of NCHL's signature resources for the healthcare community, NCHL's competency model. I'd like to turn it over to Melanie Standish, who was actually very instrumental in the development of this model, and she's going to lead our discussion today. Thank you, Melanie.
Thanks so much, Leanne. Hi, everyone. As Leanne said, my name is Melanie Standish, and I'm a program manager for NCHL's Leadership Excellence Networks. It is really an honor to be able to lead this discussion today. The competency model means a lot to me, as it does to the people on this call. We're welcome today. I'll have them introduce themselves in a second, but Jeannie Armentrout, Executive Vice President and Chief Administrative Officer at Carilion Clinic, Andy Garman, professor in the Department of Health Systems Management at Rush University Medical Center, and then Anthony Stanowski, President and CEO of the Commission on Accreditation of Healthcare Management Education. It's a mouthful, CAME for short, as most people probably refer to it as. The way I'm going to kind of lead this discussion today, I first want to kick it off by having each of our panelists briefly introduce yourself and what is your experience with the NCHL Health Leadership Competency Model. Jeannie, would you like to introduce yourself really quickly?
Sure. As Melanie said, Jeannie Armentrout from Carilion Clinic. I have a long history of being in the Human Resources and Leadership Development Department. Our organization is in the midst of adopting the competency model, and you're going to hear more about that later. And I'm quite passionate about leadership development, so I'll impart a little bit of that today. Thanks.
Great, thank you. Andy Garman, would you like to go next?
Sure. So my name's Andy Garman. I'm a professor in the Health Systems Management Department at Rush. You could think of me as Leanne Swanson's warm-up act. I was in the role getting ready for her to come and take things to the next level. I also recruited this talented individual, Melanie Standish, over to NCHL, and she was instrumental in the revision, which I'm going to talk about in a few minutes. My experience with the model dates back to the 2.0 and 2.1 versions, which we adopted into the graduate program in the mid-2000s. And they were very instrumental in helping us move the program away from a knowledge-focused program and towards a competency-focused program.
Great, thank you, Andy. And then last but not least, Anthony, would you like to introduce yourself?
Thanks, Melanie. Appreciate being here, and thanks for being part of this great panel. I'm Anthony Stanowski. I'm the president and CEO of CAME, the Commission on Accreditation of Healthcare Management Education. Yes, it is a mouthful. I think, why the competency models are important is because all of the CAME programs, accredited programs in healthcare management, as well as our healthcare quality and safety programs, have to adopt the competency model. So we'll be talking about that a little bit later on.
Great, thank you so much. Just kind of for flow of discussion today, so our audience knows, we'll give a broad overview of the NCHL competency model. We'll talk about how we use it to develop future healthcare leaders and graduate students, and then talk about how it's implemented in practice, which is one of the most common questions that we receive over at NCHL about the model. I would like to turn it over to Andy here and have him tell us a little bit about the model and its historical importance to the field. He provided me with some slides, so I'm going to pull them up, but Andy, I'll refer.
Sure, happy to do that. While Melanie's pulling up the slides, one other quick comment about my own background. Some of you may know I have a bit of a professional identity disorder. I started my professional career as a clinical psychologist and then migrated over to industrial psychology, which is significant when we talk about competencies, because the word competencies gets used in different ways. And one of the things I do want to develop some clarity around for us here is what we're collectively talking about. And so the definition that I like to use for competencies is they're an articulated definition of actions leading to successful performance. So I would distinguish competencies from the very confusingly similar sounding competence. Competence is really a measure of a professional's capability in carrying out those competencies. So in terms of the history, I think it's helpful to think about what has been the role of competencies, because that will start to explain NCHL's historical interest in them. The first start with that, what I'd like to say is a little bit about competencies as they relate to individual development. So if we set competencies aside for a second and we just think about principles of adult learning, very quickly, the best predictor of future performance, not surprisingly perhaps, is past performance in similar contexts. Putting that down, the next thing to be clear about is the fastest path to leadership effectiveness in particular. Practice in those comparable contexts is number one. Number two is high quality feedback on that practice. And then number three, application of that feedback through more practice. So that obviously raises the question, what is high quality feedback? This is where competencies come in. Competencies provide that articulation of what success looks like behaviorally. There's some other elements that are important as well. These get into the the practices of effective feedback and effective mentoring. But really, if you think of competencies as that language that gets you to high quality feedback, I think that's the best way of understanding the role of competencies. They've been involved with the professions for many decades, but healthcare administration as a field was a little bit newer to competencies. And if we dial back to like the early 2000s when the National Center for Healthcare Leadership was first established, competencies were starting to take root in organizations as related to leadership development, but they were not yet a part of the common operations of most health systems. So if you would go to the next slide, Melanie, the way that I like to describe the role of competencies in organizational performance is to create a little bit of a distinction between senior leadership's perspectives on strategy versus the lived experience of individuals working within those organizations. So if we start with governance and we think about governance working with senior leadership to set up strategy, the fantasy that we all as senior leaders would have is strategy leads to execution, execution leads to outcomes. We tend to have pretty good definitions on strategy and on outcomes. Execution ends up being the thing we need to sort of figure out so that we can make the magic happen. Almost inevitably, execution doesn't go the way that we think that it's going to go. This is just the reality of organizational change and their complexity. So what then starts to happen is we get this patchwork of efforts to improve on execution. These bring in your things like total quality management, your A3s, your behavior-based interviewing, team steps, plain tree. Okay, I'm running out of these. But if you've had the lived experience of working within organizations, this may be a familiar phenomenon to you. As soon as we have more than one of these going on at the same time, we're asking our staff to do some pretty heavy lifting in terms of sense making. Which is, okay, are we still on this old thing that we were doing, the TPS, or do I put that aside and I start working on the A3s? How does this all fit together? What competencies do is they help step in and make some of this stuff more clearly articulated and for us to have a more of a common understanding, a common language around performance. So if we replace this diagram here with one that does this articulation, it starts to look a little bit more like this. We still start with strategy, set with governance, but competencies is giving us what does that success look like? It also allows us to more clearly measure what's missing from how we're approaching things right now. So we can turn this into a development agenda, which then leads to our outcomes. If you look at a high level at some of the key initiatives that NCHL has been pursuing over the years, we have the competency model as one. We have the best organizations for leadership development survey and the resulting outcomes as another. That's where these two pieces fit into this more strategic approach to leadership development. And then to really have a sophisticated support structure for this, this is where the talent management piece comes in. And talent management brings in your various elements. All of these can be informed by your core competency model, which then leads to more successful outcomes. If we could hit the next slide. We're on 3.0 with NCHL. The first of these models was rolled out in the early 2000s. ACT was the organization that NCHL originally worked with. The 2.0 model kicked up the sophistication of the model quite a few notches. They brought in the Hay Group at that time to work on really building the model out. If you look at best practices and competencies, you typically want to do a major revision in not more than about a 7 to 10 year time cycle. So without going too much into the details here, although if anyone's interested in the Q&A, I'm happy to speak to them. There's two big steps. Step one is some systematic future scanning. What is the future going to look like? You know, not next quarter, not next year, but 10 years from now. What are the major trends that we need to be thinking about to prepare future leaders? As a graduate program faculty like myself, this is the time horizon I'm looking at, is preparing people for the trajectory that they're going to be on, not just their first stop. Step two then, with this broad framework, is to do a deep dive into what's going on in the workplace right now and how to differentiate the highest performers from the typical performers. This follows some methods that were originated with Richard Boyatzis and the folks at Hay Group. What we were able to do, Melanie, myself, and the research team, is add some new technologies, some new approaches, things like natural language processing, which allowed us to do some things that simply weren't possible when these strategies were first rolled out in the 1980s. What this gave us is the 3.0 model, which I'll show on the next slide. We won't go into depth on this one. This is available through NCHL. And if folks are interested, there's resources available in terms of the revision and revalidation work. But mainly want to underscore the point, by way of bridging to Anthony's comments, that we've done a lot of work looking at how this model can best inform CAMI programs. And so there is also a publication that's publicly available. It's open source in the Journal of Health Administration Education. If folks on the call are interested in applications to the CAMI domains, we've got something that can give you a very good head start.
Thank you, Andy, for the overview. Certainly, if you are interested in NCHL's competency model, you can request it via our website. I believe the new domain is nchl.org/research, and you should be able to find the competency model on that page. With what Andy said, and in transitioning to Anthony, you know, in the beginning, Anthony, you mentioned that it is a requirement of CAMI accredited programs to use a competency model. And so you have a lot of insight into what does competency development look like in graduate management education. So if you could speak a little bit to that and your experience with competency development of future leaders, I'd love to hear more.
No, thanks, Melanie. I think there was a real interesting slide, Andy, that you had put up there, and it basically showed that there's a big difference between seeing an opportunity and seizing an opportunity. And that's what competencies kind of bring you to do, to enable you to happen. Before I kind of get into some of the things about how our programs work with competency development and the importance within management, we did a little analysis, and I want to kind of bring it up because, you know, one of the questions is how widely adopted is the NCHL model among CAMI accredited programs. So every year, all of our programs have to complete an annual survey, and we use that survey as part of CAMI to kind of monitor our programs to make sure they're still capable of providing students with a high level of education. So this, the analysis that you have here shows what are the most widely used competency models by CAMI accredited programs. And you can see about 40% of all of our accredited programs, as well as some of the programs in healthcare quality and safety, use the NCHL model, leadership model, as either the whole model for their competencies or as a strong basis for the development of their model. And you can see some of the other models that are there, you know, ranging from the HLA model, which was a collaborative model developed by several other associations to kind of look at leadership, the St. Louis University model, some of that are totally self-developed, and some other models that are in there, as well as specific models in that other for the healthcare quality and safety group. So I think this really kind of says, hey, if you look at the NCHL model and you really kind of use it and adopt it, it's a great model for you to look at. So let's take that slide off and let me go into, your question about the CAMI programs, why they work with competency development and management, and why it's important for developing future leaders. So there's a real easy answer for this. Competency development's important because it shifts the focus from what you know to what you can do. What you know to what you can do. And one of the leaders at CAMI, and I had really the good fortune when I was on the board at that time, and I think Andy, you might have been on the board of CAMI during the time, was Dr. Tom Royer, who was still is a surgeon, but he also led Christus Health System up at the time. And he once said, anatomy is a body of knowledge. Performing an appendectomy is a skill. So anatomy is a body of knowledge. Performing an appendectomy is a skill. You need the former in order to do the latter. But if you don't have the competency or skill to perform the surgery, well, let's just say the patient probably won't wind up in a good place. So the traditional way of thinking about education is a transfer of knowledge. Knowledge is great, right? Competency is great, but the combination of both really encourages people to trust you and increases your power of enchantment. And what that means is that in this world, the combination of both having the knowledge and having the competency to really get across what you need to do, that's how you become a really effective leader and a breath of fresh air. So let's look at leadership. Myself, I don't believe you're either born a great leader or you're not, right? What are the real world skills that help our graduates and help professionals really become a highly effective leader? And how do programs really kind of approach the development of competencies within our graduate schools? So let me kind of talk about some examples of how our graduate programs kind of look at competencies and kind of make students better. And what I want to say is, look, I get in a lot of trouble for pointing out one program or another. So this is just between us, right? I mean, no one else is going to hear about this, right? Right, Melanie? It just kind of sticks here. All right. So yesterday there was a discussion during ACHE Congress on the roles of executive and residents. And I don't know how many people kind of attended that, but it was a great session. There were a lot of program directors there, and there were some healthcare executives there. Ellen Everett from the University of Kentucky was there. And when our site visit team visited the University of Kentucky program, well, what they found is that the team noted their impressive and dedicated board of advisors that was highly engaged and served as a source of industry insight for the program to help that program to continue to refine its competency model and to ensure that its students become better and very highly skilled leaders once they graduate. Now, the Kentucky model was kind of interesting and kind of held up as an example of a great model, but there's another one I want to point out too, and that's Trinity University. And Trinity also was kind of seen by our site visit team as having an exceptionally strong and actively engaged advisory board. And they noted that the advisory board had a variety of different stakeholders on it, including faculty, students, and providers. And they all provided insight into the health sector trends and recommendations for ways in which the program could modify its mission based on that. But what I thought was really interesting with Trinity is they have a specific focus on innovation. And that's one of the areas right within the NCHL model. So they chose to kind of focus a little bit more of their competency model in that area and want their students to become more highly engaged in evaluating innovation and implementing innovation. So again, a way that a program's kind of looked at that. Let me kind of give you some other examples too. Texas A&M, they have a big focus on preparing students for rural health settings. And that model is kind of focused on that. But let's just compare that for a second to the Boston University competency model, where a lot of their students in their MBA programs go into big pharma. So the skills and competencies that these two programs teach their students should be very different, and in fact are very different. And that's why competency model management is really kind of important in terms of program directors. Now finally, just one more thing around this is you have to continue to look and refine the models. And I think what NCHL has done with version 3.0 is really important and relevant, particularly in this time. The skills graduates need today are not the same skills that they needed 10 years ago, or even dare we say 12 months ago. So who among this group remembers 2019, right? It feels like a different time period when you think about it. COVID's impact on digital communication, collaboration, telehealth is stunning. I was talking to the president of the American Telehealth Association, and she was saying that what's occurred over the past 12 months in telehealth kind of force multiplied over where a telehealth was prior to COVID. So that's a whole kind of part to kind of think about. What are the skills that students need, and how do you change the model? Now, one more thing to kind of think about, because all this right now, kind of look at our miracles of EHR and just kind of accept it. Remember, EHRs occurred because of the High-Tech Act. That's what really put EHRs into hyperspeed. And the High-Tech Act was created, does everyone remember this, as part of the American Recovery and Reinvestment Act in 2009. 2009, just a little over a decade ago. If it weren't for that investment, the things that we're talking about in analytics and electronic health record and communications with the public would have been a far different conversation than we had today. So, I think the real world challenges that healthcare has and influences the skills graduates need now and what they'll need in the future. And they'll highlight the critical responsibilities of our programs, the great programs, Andy's at Rush right now that really kind of work through. So what's CAMI's role in all of this? Well, our role really is our board recognized the need to constantly monitor changes in the health sector. And we do a really good job of that. We require accredited programs to revise their competencies based on the needs of the health sector and based off of the industries and the sectors within that their graduates tend to go into. So that's what our board and what our site visitors kind of focus on. Now, I want to give one more thing before I kind of turn it over to Jean. Another important piece of competency management is continuous improvement, and that's continuous improvement for the students. So how do you look at and monitor and measure your students so that they're improving their competencies over time? Great program to look at this is the University of Iowa, which has really excelled in utilizing a very impressive tracking student for a tracking system for students. And it provides a systematic review of individual student competencies across cohorts, classes, semesters, and allows for access to quantitative and qualitative assessments for all students in that track. But the granddaddy of all programs came from Army Baylor. And it was very interesting because programs really had a hard time not developing what the competencies were, because that was looking at what their students need in the environment and where they were going. But how do you measure how well students are moving through? And it was the military, it was Army Baylor that really kind of created a competency assessment tool that was very effective. And what's interesting there is that many of the alumni of the Army Baylor faculty, people like Forrest Kim, who's now at Baylor's MBA program, and he will be CAMI's board chair in 2 years. He'll be chair-elect starting July 1st. People like Forrest, people like Lynn Downs and Chris Nesser at Incarnate Word are really kind of promulgating that approach going forward. So that's, I think, a kind of in a nutshell where CAMI is and why we're important in this area.
Thank you, Anthony. And, we want to develop our students who are going to be moving into healthcare and changing the future. And then we also have what's happening in practice and how we go about developing leaders. So I do want to turn it over to Jeannie to learn a little bit more about how Carilion Clinic is going about competency development with our competency model. And I'll go ahead and share your slides, Jeannie.
Thanks. So you can tell the three of us could probably talk about this all day, and we may have to have another follow-up session at some point to, to keep going. But first I want to brag a little bit. I want to brag about NCHL's model because it is becoming widely adopted and it's credible. It brings standardization to our industry and a common language and also focus. A unique aspect of the model is the proficiency leveling system, which really maps a leader's journey from novice to expert. Well, novice to expert has been around a long time, but we find ourselves still coaching leaders to achieve the subtle but more difficult skills that you see as you level up. I do want to take a minute to brag on Andy's pending publication that was sort of hinted in his presentation. I have seen a preview of it, and I highly recommend you get a copy because it brings together all of what we are talking about today. So on to Carilion Clinic. At Carilion, we have a dedicated department, the Institute for Leadership Effectiveness. This team is award-winning. They received the Cubic Awards and the top 125 training rankings from 2004 to 2016. But no matter how good you are, you do have to keep evolving. And leadership skills and what we face in the future continues to evolve. So in 2018, we started adopting and integrating the NCHL competencies. So I'm going to show you our current model, and you can see pretty quickly there are 8 of the 26 NCHL competencies. And you might ask why. Well, we are adopting this long-term, and we're adopting it in about thirds. Each of you and your organizations will have to figure out, how do you make it work for you? How do you thoughtfully implement it so that you can pull this model through the organization? So with each of these competencies, we are building learning resources. We're embedding them into our hiring and promotion and performance management systems. And this takes a while. Like most of you, the resources that go along with the competency model include leadership assessments, simulation experiences, self-directed and instructor-led activities, and coaching. And I would say, most importantly, practice. So in our organization, we are emphasizing a culture where practice is the norm. If you are an HR or a development professional in healthcare, you must have a passion for implementing these important competencies, because you will have to push them uphill to embed them into the fabric of your organization, because no one else will. And then once you start adopting them, the hard work begins. So you have to look at outcomes. So I'm going to show you just the next 3 slides very quickly, just to show you what we're doing as far as measuring mastery of these competencies. And it's really critical to do measurement. So the first one really shows you a look at our organization and how we are trying to understand the potential differences in levels of competency between new and seasoned leaders and different leadership roles. Some roles will need focus on particular competencies more than others, depending on where they are in their journey. The next slide will show you how we, of course, and many organizations do this. We measure our leaders' perception of their competency. And this really helps guide us annually on where are we going to focus? Are we going to focus on business acumen or talent development, and in what cycles? And then the last one is maybe the most important for us. We have a data and analytics team then they have been correlating leaders' strengths with employee engagement surveys. So we first implemented a very intense leadership development program that focuses on leaders who don't score well on the engagement survey. And now we are starting to correlate leadership scores and leadership competencies to predict clinical outcomes. So again, I'll sort of emphasize that, implement these competencies. They're very important. Do it at your pace and what your organization can adapt to. Also, be sure that you build in measurement outcomes and practice for your leaders to acquire these skills. So I'll pause there. That's a flyby of our story.
I love it. And we'll have to have a follow-up conversation, Jeannie, because I love this stuff, knowing that, I'm sure Andy feels this way too, when you develop something, seeing it implemented is just a whole nother story. And so it's great that you are all doing that. And looking at some of the outcomes too, you have a great people analytics team, as we know from our Talent Metrics Analytics and Planning Council for our Leadership Excellence Network. So shout out to them and Doug over there. But we are at time, and I want to make sure our panelists have time to get to wherever they need to be next. So I unfortunately am going to have to cut it short. We had a few more questions, but I think this just means we might need to have a follow-up conversation, everyone. So I'm sure you would all like to further talk about competencies. Before we go, a couple things that I want to mention. I've had a few chats come through. If you have any questions, feel free to email them to info@nchl.org, and we will get the answers over to you or connect you to the correct people if we can. We also recorded this webinar, so we'll be able to share that on our YouTube page, and I'll also make sure to send out the slides as long as it's okay with the panelists. So I hope you all have an excellent day. The final thing that I'll share with you all briefly is just that we do have a town hall series coming up for the National Center for Healthcare Leadership. These are 1 hour deeper dives into a topic. Tuesday, April 20th, we'll be talking about the impacts of the raising costs of higher education, a very important topic to be talking about. And then our next NCHL Coffee Chat will be Thursday, May 27th at 11:30 a.m. Eastern. The topic is to be determined, really similar to this coffee chat. It came out of someone, Anthony, actually emailing us and saying, hey, we should really talk about this topic. So if you have a topic you'd like us to talk about and cover, we'd love to hear more about it. So info@nchl.org. Thank you again to our distinguished panelists for joining us today, and I hope you all have a wonderful day.